very good morning to all of you. Today I am here with my study on clinical correlation of conjunctival vessel width with the grades of retinopathy in diabetes mellitus. As we all know, how to move? As we all know, diabetes is a chronic progressive metabolic disorder with various microvascular and macrovascular complications. It has emerged as a leading cause of blindness. However, blindness due to diabetic retinopathy is highly preventable if early detection and timely intervention is initiated. The vascular complications related to diabetes do not present themselves until significant microvascular damages have already occurred. Diabetic retinopathy occurs due to microvascular hemodynamic disturbance, and similar changes in the conjunctival vessels are very well studied and documented. With all this background, the aim of my study was to measure the width of the conjunctival vessel and to correlate it with the severity of the grades of diabetic retinopathy. Our study is a hospital-based observational study done over a period between May 2020 to July 2021 at RIO RIMS Ranchi with due ethical approval taken from our institutional ethics committee. All the diagnosed patients of diabetes mellitus and those who gave consent for the study were included in our study, whereas those patients who had media opacity obscuring posterior segment examination and those who had any other ocular and systemic pathology and who didn't give consent for the study were excluded from the study. 300 eyes of 150 patients of diabetes mellitus of the age group 50 to 70 years were examined. After taking the general and ophthalmic history and assessment of best corrected visual acuity, complete ophthalmic examination was done. Anterior segment imaging for the measurement of most prominent temporal conjunctival vessel width using red-free filter and distal slit lamp biomicroscopy was done. Posterior segment examination for the grading of diabetic retinopathy was done using indirect ophthalmoscopy based on the ETDRS classification. All the findings were noted on MS Excel sheet and analyzed using SPSS 21.2. Continuous data was measured as mean plus minus standard deviation. Quantitative data was analyzed using paired t-test. The value of p less than or equal to 0.05 was considered as statistically significant. Coming to the results, there were no significant difference in the sex distribution. Majority of the patients were in the age group of 50 to 60 years with an average duration of diabetes of 8.8 plus minus 3.8 years as shown in the table below. Majority of patients had mild to moderate NPDR that constituted about 55.3% of the total study population. Severe non-proliferative diabetic retinopathy was seen in 21.3% of the study population, and 14% of the patients had features of proliferative diabetic retinopathy, whereas 9.3% had no features of diabetic retinopathy. This is the table showing the conjunctival vessel width with the severity of grades of the diabetic retinopathy. The average conjunctival vessel width that was taken from the most prominent temporal bulbar conjunctiva was 27.4 micron in diabetic who had no retinopathy, and that gradually increased as the severity of diabetes increased from 32.6 micron in mild to 36.8 micron in moderate, 40.2 in severe, and 43.9 in proliferative diabetic retinopathy. This is the diagrammatic representation of the previous table, which shows the correlation of conjunctival vessel width with the increasing severity of diabetic retinopathy. In discussion, a study conducted by Khan M.A. et al. On 96 diabetic patients showed the mean conjunctival vessel width of 40.61 micron, which uniformly increased from 34.4 micron in mild NPDR to 53.5 micron in the proliferative diabetic retinopathy group, which was statistically significant. And similar results were also observed by Rishi Sharma et al. In 280 eyes of 140 patients using slit lamp imaging system for conjunctival vessel width measurement. In our study, significant retinopathy was seen among those in the 6th and 7th decade, which corroborates with other published data. Wild et al. Showed a higher prevalence of diabetes and its complications in men as compared to women, which was not observed in our study, as we found equal preponderance among both males and females, as was observed by the study conducted by Khan M. et al. Cheung et al. Studied the conjunctival vessel morphology using computer-assisted intravital microscopy and concluded significant increase in the conjunctival vessel width among diabetes as compared to the non-diabetic controls. And similar results were also obtained by Langry et al. By conducting the study through conjunctival angioscopy. Our study findings resonates with many of the published studies and establishes a positive correlation of conjunctival vessel width with the increasing rates of severity of diabetic retinopathy. Hence, I conclude conjunctival vessel width positively correlates with the severity of diabetic retinopathy. Measurement of conjunctival vessel width has potential of being a marker for early detection of diabetic microangiopathy. Detecting the changes of diabetic retinopathy early and timely intervention to halt the disease progression can go a long way in the preventing the morbidity associated with it. These are all my references. Thank you.
Thank you. One good presentation.
Thank you.
I think we'll skip the question answer session for you because you're a non-ratified member. So sorry for that.
Okay.
We cannot mark that. We move on to Dr.
Thank you,
Piyush.